Africa races to contain the growing number of COVID-19 cases sweeping the continent, and tighter measures are being enforced as the virus spreads beyond capital cities. The World Health Organization has already said the total number of beds in intensive care units available in 43 African countries is the equivalent of about 5 beds per 1 million people in reported countries, with compared to 4,000 beds per 1 million people in Europe. Let's take a look.
A team of Chinese medical professionals arrived in Abuja, bringing medical equipment worth about $1.5 million with them. Nigeria has over 280 confirmed cases of coronavirus and 6 deaths. The country's weak health system and population of nearly 200 million inhabitants means it's particularly vulnerable to infection.
We received support of all means from Nigeria. It's time for us to reciprocate the friendship and kindness.
Meanwhile, in Benin and Morocco, it's now compulsory for residents to wear masks at all times in public. Benin's government has subsidized the cost to around 30 US cents per mask, but that's still a lot for many. And those who can afford masks can't always find them.
They say it's compulsory, but I've come to buy some and I can't find any.
In Libya's capital, Tripoli, members of the Libyan Red Crescent disinfected a building housing displaced people. The country, which is divided between a UN-recognized government based in Tripoli and a rival administration in the country's east, announced its first death from coronavirus earlier this week, so far recording 19 infected cases. The rise of coronavirus in Africa's war-torn Sahel has sparked fears for hundreds of thousands of displaced people in the region, who are packed inside camps. In the Senu camp on the outskirts of Mali's capital, Bamako, refugees are fearful about the possible effects of the virus.
We're afraid of catching it, to the point that we can't sleep, day or night. I live here with my whole family, and if one of us were to get this disease, it would be a disaster. Unfortunately, we're here because we have no choice. We stay here imagining the worst, that one of us gets infected.
The economic consequences of coronavirus are being felt throughout the continent. Senegal announced an antivirus dusk to dawn curfew to curb the spread of coronavirus, which, along with flight restrictions and blow to European demand, has hit the country's fishing industry hard. Indirectly employing 500,000 people, the fishing industry represents 22.5% of export earnings. Sports events around the world have been cancelled as a result of the virus, but a team of South Sudanese sprinters are making the most of the situation. They were training in a Japanese town ahead of the now postponed Olympics, but have decided to stay until at least July, taking advantage of training facilities that aren't available to them in their home country. And finally, Burundi is one of the few countries around the world, along with Belarus and Tajikistan, to continue with its Football League fixtures. First Division team Vital OFC hope to reach the end of the championship on a high. Spectators' temperatures will be checked upon entry into stadiums, where hand washing will also be fervently encouraged.
They say that we have to wash our hands with soap or other antiseptic products and not get too close to people face to face. We should keep at least 1 meter away and not grease each other with our hands, not shake hands, no contact. So these are precautions that must be taken.
Burundi announced the discovery of the first 3 confirmed cases of COVID-19 earlier this week.
Meanwhile,